They are on the front lines every day, helping to fight an invisible enemy. Our doctors and nurses, by virtue, put themselves in harm's way to help others receive treatment and get well. And that's just what our first guest did. We'd like to welcome, after 8 long weeks in New York City fighting the COVID war, Miss Devra Wright, a registered pediatric nurse. Thank you so much for joining us.
Hey, how are y'all doing? I'm happy to
Are,
be here.
are you happy to be home?
I cannot, it's kind of a give and take because I'm happy to be home, but things have gotten so bad in Charleston, so I left New York and it's a little better up there, but I am very happy to be home.
Well, let's start there because you were in one of the epicenters in this nation in terms of COVID-19, and that was New York City. Now you have come back to South Carolina, where New York, the numbers are declining.
Right.
We're seeing a rise. So
Right.
why do you think that is?
Well, I think when I went to New York, obviously the numbers were increasing, and luckily towards the end of my assignment, they were coming down. And I think with our city opening back up and the lack of social distancing and people not being, I think the biggest thing is people just aren't as afraid. And not saying everybody needs to live in fear, but it just was very different. Like even it was when I went to New York, it was very ominous. And I mean, you were scared. I mean, and you wore your mask, you kept 6 feet apart from people. And that's because you wanted to make sure that I was protecting you and you were protecting me. And so I think it's maybe finally starting to become real in Charleston. So
Right.
people, hopefully are taking it a little differently.
Yeah, hopefully everyone's taking it seriously because certainly with taking those precautions, you do see those numbers decline. Also, the closeness that they are then developing with the families themselves who are having to say goodbye to their loved ones. And that was something that emerged from COVID-19, is that because a lot of people couldn't come to see their loved ones who were infected and being treated, the nurses took on that other role of being friend to the patient.
Right. And it's, it's always one of those things because you try to, you're supposed to keep this barrier up, with how close you get to families. But on times like this, you just have to, your guard is just down and you grow to love, your patients' families. And because you are that one straw to their loved one to help, be with them and to, talk to them. And even if they're intubated, you still talk to them and, try to give them love and support and try to convey messages from their, families. So,
Absolutely.
I mean, you're that one person.
And this is a perfect place to take a break. So when we come back, I want to talk about more the experience you had for the COVID-19 patients and how different that's been in your career. So we'll be right back. Don't go anywhere. Welcome back. We've been chatting with Devra Wright, a registered pediatric nurse who is on the front lines of COVID-19 in New York City for the past 2 months. She's now back in South Carolina. We're so happy to see you here. We're so happy to see that you're well and healthy. Just wanted to ask you what your expectations were when you first heard about COVID-19 and how dangerous you knew it would be or didn't know it would be down the line.
Well, to be honest, that was one of my thought processes when I was thinking about going up to New York. And, I had a family Zoom meeting with my parents, and we really thought, I was terrified for my life. I did not know if I would survive it. And I truthfully thought that I could die from going up there. And when I landed in New York, I was scared to death. When I walked into the hospital, everybody that was there, they understood how serious this was because of course, the death toll, but you could have somebody that's on nasal cannula that you're treating, and then all of a sudden they can no longer breathe and they have to be intubated right away to survive, or they would go into respiratory arrest.
Did it feel more like second nature though, as time went on, that you just took those certain protocols and you felt like you would be safe, or did it always feel like a threat?
It always felt like a threat. I don't think I ever let up. And I mean, because you still would see the patients, how they breathed, and I mean, just how much they were suffering. And that's why I try to tell people, you don't know, how these people were suffering. And of course, you can't be with your families.
Right.
So you have your loved one that is, sick, and they're in this hospital ICU bed by themselves. But what I want people to understand is my patients I didn't take care of 70 and 80-year-olds. The PICU that I was in, we were converted into like a 20s to 30s. So we had young adults, and those were the ones. And then I also would float to other units where I would have pediatric patients. But you could have somebody is a picture of health that works out, that eats right, and that they could have this reaction. There are different strands, and you don't know how it's gonna affect you.
So it is non-discriminating. So any final words of wisdom after seeing it firsthand? Any final words of wisdom for anybody who's watching this who thinks, I don't need to wear a mask, herd immunity, blah, 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 vaccine one of these days? I mean, what can you tell people to ensure that there is another flattening of the curve right here in South Carolina?
I think if you would like to not see your neighbor, your mother, your father, your grandparents die, then I think you really need to pay attention and wear a mask and keep your social distance. And maybe you might get light symptoms or mild symptoms, but you could give it to somebody that could potentially die from this. This is not something, I don't want to like scare everybody, but in the same sense, you don't want what happened in New York City to happen in our great city of Charleston.
Ms. Devra, thank you so much for sharing your story with us, and thank you for sacrificing your own health and helping others receive the treatment they need during this pandemic.
Thank you. Y'all stay safe.
You truly are one of our heroes. Thank you so much.
Thank you. Bye. Have a great day.
You as well. We're back in 2 minutes.